Hi everyone. If you are new to this channel, I am Dr. Himadri. So let's talk about orbital cellulitis. What is orbital cellulitis? Orbital cellulitis means you can understand this is actually inflammation of the tissue of the orbit. The tissue present within the orbital cavity. If there is inflammation of this tissue, we call it orbital cellulitis. It is characterized by usually a triad. The triad is proptosis. Means the anterior bulging of the eye. Suppose this sided inflammation is present, there will be anterior bulging of the eye. This is called as proptosis with painful limitation of movement of the eye, which is termed as ophthalmoplegia. There is limitation of movement of the eye along with potentially decreased visual acuity. So never forget there are three things which basically defines this inflammation, the triad, that is proptosis, that is anterior bulging, followed by and another thing is that there is movement restriction, painful movement restriction or ophthalmoplegia, and also there is potentially decreased visual acuity. So it basically constitutes your orbital cellulitis. Okay. So the orbital cellulitis, what are the common organism and what are the causes? The most common cause is paranasal sinus infection. This is your nose, and around the nose there is paranasal sinuses. If there is infection, this infection can directly go and infect your orbital region, leading to orbital cellulitis. Okay, the paranasal infection, paranasal sinusitis, there could be direct trauma to the eye, or could be some fungal infection, especially in the immunodeficient states. Okay. So what are the common organisms which basically causes it? The common organisms, never forget your Staphylococcus aureus. This is very notorious organism, and your Streptococcus pyogenes and Streptococci pneumoniae, and also some anaerobic organisms like bacteroids and also Prevotella species. Okay. So what are the symptoms? The symptoms are rhinorrhea, chemosis and vision loss, painful extraocular motions, and also there is proptosis and ophthalmoplegia, and also there will be fever and lid edema and leukocytosis. These are common things. So we have a classification for this. We call it Chandler classification. The Chandler classification consists of group 1 to group 5. Okay. Group 1 means there is preseptal infection. Preseptal infection is called as your group 1. Preseptal means your eyelid. When the inflammation of the eyelid that you can see from outside, this is called as your group 1 infection or group 1 classification of the Chandler's classification. And group 2 means when the infection and inflammation spreads from outside to inward tissues, that is within the orbital tissues. You can see the orbital tissues are basically inflamed. This is group 2. Group 3 means there is formation of pus. The main difference is not only in group 2 there is edema. There is edema and also inflammation in the tissue. But here there is formation of pus from group 3. The pus is in subperiosteal region, that is it is your bone, and there is periosteum. In between bone and periosteum there is collection of pus, you can see. And in group 4 what you can see is that the infection and the pus spreads throughout the orbit, and in group 5 there is extension of this pus, and infection basically extends inward and goes to the cavernous sinus, causes cavernous sinus thrombosis. So once again, group 1 is only inflammation and edema, basically preseptal cellulitis, inflammation in the eyelid that you can see, and also the orbital cellulitis, that is post-septal cellulitis, is group 2, post-septal cellulitis. And also group 3 is your subperiosteal abscess, group 4 is your orbital abscess, and eventually in the last there is cavernous sinus thrombosis. Please look at this image. This is your preseptal edema, you can see preseptal edema, group A1, and group 2 is your post-septal edema. This total area is basically edematous. This is your post-septal, or and also this is your group 3 where there is subperiosteal pus collection, and when the pus collection spreads throughout we call it group 4, and group 5 is the extension of this infection into the cavernous sinus, causes cavernous sinus thrombosis. This is a CT photo, you can see CT scan what we can find here. This is type 1 or group 1, this is group 2, this is preseptal edema, that is type 3 or group 3 in Chandler classification. This is type 4, and also this is type 5, which is going inside. Okay. What will be the feature for cavernous sinus thrombosis? The features are, when there is intracranial extension of this infection, there will be headache and also vomiting, and also there will be focal neurological findings. Okay. So how cavernous sinus thrombosis actually develops? Remember, this is your facial vein. From the facial vein we have infraorbital vein, and this is your inferior palpebral vein, and this is your angular vein. So these veins are basically going inward, and this is your lacrimal vein, which is basically joining and forming here your superior ophthalmic vein, and this is your inferior ophthalmic vein. This is your inferior ophthalmic vein. This is superior, and also this is inferior ophthalmic vein. And there is another vein, that is central retinal vein, which is draining the retinal part and also draining into the superior ophthalmic vein. Remember one thing, all these veins have no valve within it. As there is no valve, blood can flow in either direction, come inward or can go outside. That is the main issue. So if you can understand like this, like if you are sitting or you are standing like that, so there will be the because of gravitational pull, your blood can go in either way, that is can go inside or can go outside. That is the reason, if there is any infection in the orbital region or infection in the paranasal sinus region or in this region, the from facial vein and angular vein and superior ophthalmic inferior ophthalmic vein, it can directly go into your cavernous sinus. Here is your cavernous sinus. That is the reason there could be cavernous sinus thrombosis if you don't treat this infection in early stage. Once again, this is your superior orbital fissure, and the vein is coming and draining into the, this is cavernous sinus, this is once again cavernous sinus, and this is your basilar plexus, not important. Okay. Once again, this is your, you can see the venous drainage pathway, superior ophthalmic vein and inferior ophthalmic vein, eventually draining into cavernous sinus. Remember one thing, in the cavernous sinus, inside the cavernous sinus we have internal carotid artery, and internal carotid artery has the sympathetic plexus outside it, and also in the lateral wall of the cavernous sinus you can see there is oculomotor nerve, or the third cranial nerve, then fourth cranial nerve trochlear, and sixth cranial nerve is present inside abducent, and this is your fifth cranial nerve, and also this is your V1 branch and V2. That is, so one thing, so in cavernous sinus thrombosis, before cavernous sinus thrombosis we have another entity. The thrombosis actually, if it goes via the superior ophthalmic vein, look here, this is your superior ophthalmic vein, this is the normal side where we have given the contrast, and also this is basically white, you can see this is basically white, appearing white, but this is typically a tram track sign. Why tram track sign? Because the thrombus is present inside, therefore it is appearing as a tram track. So this is your thrombosed left sided superior ophthalmic vein thrombosis, thrombosed superior ophthalmic vein in the left side. Okay, so cavernous sinus thrombosis in this photo, this is your right sided cavernous sinus, there is thrombosis, the black dot is here, your thrombosis. Look, another sign, this is your MRI photo, this is MRI. In MRI what you can see is that the right sided cavernous sinus is looking enlarged in comparison to the left sided cavernous sinus. Look, from this to this direction it is actually enlarged. Number one, there will be enlargement because of the thrombosis, and you can see there is some density changes here in this arrow. So this is your cavernous sinus thrombosis. What are the features of cavernous sinus thrombosis? Please remember one thing, that is P, PD and also PDO. That is your external ophthalmoplegia. P means there will be the ptosis. You can see there is ptosis. And what means PD? PD is pupillary dilatation in the affected site, and PDO means pupil is down and out. Pupil is down and out. So this is your external ophthalmoplegia. Probably there is cavernous sinus thrombosis in the left side of this patient. This is another photo, septic, totally septic. There is another child. This child is actually admitted in our hospital. So this child is having a history of insect bite 7 days back in the left sided eye, and there is inflammation. You can see there is orbital cellulitis. We did MRI. In the MRI you can see there is, so in the MRI you can see there is subperiosteal pus collection or subperiosteal abscess. So here in this photo also there is subperiosteal abscess. This is subperiosteal abscess, and also there is, look, there is paranasal sinus infection along with subperiosteal abscess. So this is probably type 3 Chandler classification.